Hello and welcome to a special interview for The Wire supported by Glenlivet Books. Has the British government made the wrong decision in lifting all COVID restrictions as alleged by over 100 international scientists in a letter to The Lancet? Or does the data suggest that in fact it was well considered and well thought out and might now possibly even be paying off? That's the key issue I shall raise today with Professor of Global Public Health at the University of Edinburgh and the author of Preventable, The Politics of Pandemics and How to Stop the Next One, Devi Sridhar. Professor Sridhar, as a professor of public health, how do you view the decision of the British government to lift all COVID restrictions despite the fact the Delta variant is still spreading and despite the fact cases are growing at about 29,000 a day, on the strength of the fact that mortality and, more importantly, hospitalization has markedly come down and therefore will not threaten the health system?
Yeah, so I think vaccines have definitely changed the picture. And in Britain, there's been a massive rollout, hugely successful in terms of the uptake in elderly groups. But there's still a problem that the link isn't fully broken. It's just weakened. So we are seeing hospitalizations in younger people in under 40s, for example, who are not as severely ill, but still might need oxygen or fluids or to stay a couple nights over in hospital, even if they don't get to ICU. So I think, the messaging about Freedom Day, the pandemic is over, was a little bit deceptive because it's not over, as we know across the world. And whenever we've seen places declare the pandemic is over, it's come back with a vengeance. So I think idea was we should ease slowly, but of course, keep restrictions in place where necessary to make sure everyone can get vaccinated. And I think we are going to see that because what we've seen in the past few days, since it's been a week now, is that people haven't really changed their behavior. Though more things, you're able to do more things. Gyms are at full capacity, restaurants full capacity. People aren't necessarily going into those places because they've changed their behavior to make sure they can keep themselves safe.
Now, the decision was taken at a time when something like 70% of the British adult population has been fully vaccinated and almost 90% have got at least one jab. But when you look at that in terms of the full population, the percentages come markedly down. Only 55% of the full population is fully vaccinated, and just about 70% has a single jab. So how large is the risk this decision to fully open entails?
Well, I think there was a calculated decision made that younger people would just get COVID and they would just have to hopefully not get that ill with it. So the idea being that you have what some have proposed in government is hybrid immunity, a mix of vaccine-induced immunity in older groups and natural immunity from getting COVID in younger groups. But I think scientists who've signed that letter and others across the world have expressed concern about this because we don't want COVID becoming a disease of the young and seeing substantial morbidity, long COVID in younger people if we can prevent it through a vaccine that we now have that's approved and available for those who are 12 and older.
I'll come to the particular problem you're mentioning about young people and the possibility that they'll get long COVID in a moment's time. But let me first point this out. When restrictions were lifted, and I'm talking of the weekend before Monday the 19th, cases were growing at an astonishing 54,000 a day. And your health secretary, Sajid Javid, even tweeted and accepted that it was possible that by the end of July, they could be growing at 100,000 a day. But that very clearly hasn't happened because I noticed that yesterday, the daily increase was down to 29,000, which is hugely different to 54,000. So now when you look back over the week, do you think the British government may have taken the right call? Or have they just been lucky, possibly for the wrong reason?
Well, I think there are two things there. The first is that confirmed cases are coming down, but we have a survey called ONS that just takes random, swabs from the population, and that is going up, meaning that while less people are getting tested and we're having confirmed cases, community infection is actually going up. So that's quite interesting first to see that divergence. And the second thing is that people have changed their behavior because personally, I think because they don't trust the government. And so they are making decisions over what they will do and not to make sure they don't get the virus. And so I think in some ways, that was the hope of the government, that people would be warned, be cautious, be aware of what you're doing, wear face coverings if you want to. They made it about individual behavior. And what we've seen is after 18 months, after having one of the highest death tolls in the world per capita, after, seeing many people getting ill, hospitals full, people are nervous. And so their behavior has shifted to say, actually, we're not going to take hold of everything that's opened. We're going to be more cautious in how we re-engage.
You're making a very interesting and I would say important point there. The risk the British government took, which was the main point in that letter by 100 international scientists to Lancet, has been substantially ameliorated by the fact that actually people are behaving very cautiously and sensibly. They may call it Freedom Day, but they haven't embraced their freedom fully. In other words, the responsibility people are showing has ameliorated the risk the government took.
Yeah, exactly. And that's because of the past 18 months that we've had. I mean, people have lived through COVID. They have seen, everyone I think knows someone who either has long COVID or who has been in hospital or who has died of COVID. I mean, it's been that prevalent in the UK. So there is a sense of caution, which is many employers saying, okay, the government doesn't require face masks, but as an employer, I'm requiring you to wear them in the office. Or even though the government said people can go back to offices, employers are saying, no, work from home still. You're seeing this also even on public transport. There's not a mask mandate legally, but people are wearing them because they say, actually, I want to continue to do those things. So as I said, I mean, it is interesting, even from business owners' perspectives, that it's not like things are as pre-normal levels. Cafes aren't as full, restaurants aren't as busy, because there's been that 18 months of experience where people are actually just treading cautiously to see what happens in the next few months.
Now, when those 100 scientists wrote to the Lancet, it was only roughly 3 weeks ago on the 7th of July, they did not expect, certainly they did not anticipate that people would behave as responsibly as they have. Do you think the British government anticipated this responsibility, or has the British government turned out to be correct, but for the wrong reason, as I said a moment ago? They're lucky that the British people are behaving responsibly. Had the British people embraced freedom, as that catchy phrase suggested, Britain could have been in terrible trouble today.
Yeah, and I don't think we're out of trouble, to be fair. I mean, we're in summer, right? So this is anyways when we see that people are more outside, there's less mixing. Schools are shut, meaning young people are not mixing. Many people are away on holidays. We know are out in countrysides in a way, and things are generally more quiet. I think the real challenge is going to be what happens in September. Schools go back, winter hits, people go back inside, and you have all the normal respiratory pathogens coming back and hitting the country. So I think, the question is the pandemic over? Clearly not. And I think the idea was, are they trying to give some freedoms and take them away? I don't know, at some point in the future. But I think right now, could we have anticipated the numbers coming down? Probably not in the way they have. But I think it just shows, again, people have learned. I mean, and they have that option. That's the other thing to say. I think in other countries, there's not the option that people can change their behavior because of their jobs or their livelihoods or their living situation, where in Britain, generally, people have had a choice to work from home, to go into offices, to go into supermarkets. And so that element of choice has been there.
I note that point, that when you give people a choice, they usually act responsibly. But before I come to the point you made earlier about young people getting COVID and the long COVID they could end up with, one more question about the impact of lifting restrictions. We've talked about it in terms of increasing cases, and astonishingly but delightfully, cases are coming down, not going up. What is the big picture in terms of hospitalization and mortality in the last 1 week since restrictions were lifted?
So mortality continues to stay low, and hospitalizations, it seems like it's not broken but reduced. So in the past, about 13% of confirmed cases were turning into hospitalizations, and that's come down to about 3%. So it's not gone away entirely, but it's come down. And so right now, the challenge is to vaccinate enough of younger people to make sure they don't show up in hospital in their 20s, in their 30s. I mean, the other thing to say that has been a huge success is the uptake. We have not seen hesitancy to the levels that we expected. I mean, this is the most successful mass vaccination program, I think, in history. I mean, levels of over 95%, 90%. I mean, it's astonishing, right? To think that percentage of the population getting it. And younger people also now demanding the vaccine, and, over 20s wanting to have it. So I think that's also been helping, obviously, because then you have more people protected.
Let's now come to that point you were making earlier on about young people getting more infected. Data released by Britain's Office of National Statistics shows that cases in the 11 to 16 age group are 4 times more common, and in the 16 to 24 age group, 6 times more common than the 50 to 69 age group. Now, I accept that this demographic is unlikely to fall seriously ill, but they can still get, and as you mentioned this yourself, long COVID. And long COVID is not only debilitating, but it will put pressure on the health system as well. So my question is simple. Do we have a problem in the making, or could this end up being an exaggerated concern?
I think the honest answer is we don't know, right? And I think there's uncertainty, and in that uncertainty, different specialists are seeing different things. So some pediatricians in Britain say to me, I'm not really worried about kids getting coronavirus, this one, COVID, because they all get many coronaviruses. That's just what kids get. So they're not concerned. But then you talk to pediatricians in the United States, in South Africa, in India, in Australia, and they're saying they're very worried because it's not an innocuous virus in children. It can cause substantial morbidity. They have seen hospitalizations increase in adolescents. I mean, you've had, a couple hundred children die in the United States of this. So they say, why take that risk with children when we have a way to prevent it? Just last week, a healthy 5-year-old died in Alabama of this, no pre-existing conditions, just unlucky. So I think this is where it's really tricky, because I think just to say it's innocuous isn't the complete truth, but to say it's very dangerous isn't either, because a lot of children are asymptomatic. So it's somewhere in the middle, and it's uncertain. And in that uncertainty, we're seeing different approaches being taken, either in the Britain advocating a more natural infection model, or other places saying, actually, we have to have a no tolerance approach to children getting infected.
That's one risk that you're referring to. Let me bring up a second risk with you. Is there a risk that as infections increase amongst the young, it could also fuel the spread of infections amongst the rest of the population? And although the rest of the population is vaccinated, as you know, vaccines are a guarantee against serious illness, not against infection.
Yeah, that's a major concern as well, because what do you do with children who become infected and then go home and might infect their parents or their grandparents, and also might result in a new variant emerging if you have quite a lot of transmission occurring, which results in more chances for the virus to mutate, to replicate, and to develop into a more dangerous form. So that is a concern. And I think all we can say is that, this is also something why we need to suppress overall. And I don't think we can take our eye off it yet. Some people have suggested in England, we should stop counting cases, just move on. And I say, well, I think even for research purposes, we need to keep tracking this, because in my view, we're maybe halfway through the pandemic, but we're nowhere near, in terms of globally, the end of this crisis. So we need to keep our eye on the ball and not suddenly get, complacent because we think it's finished.
Now, an article yesterday in the BBC quoting several British doctors brought up yet another potential risk that lies on the horizon. It says that as cases are allowed to increase, or at least happen in a fairly unchecked way, is there a danger that the virus could be given an opportunity to mutate? And I noticed that Professor Jonathan Ball of Nottingham University put this most strongly to the BBC. He said, and I'm quoting him, in a population with partial immunity, particularly if a virus is spreading in the background, that will encourage a virus towards immune escape. That, he said, is inevitable. How large, how serious is this risk?
Well, it's a massive risk, because our main defense now against this virus is vaccines. And we need our vaccines to stay effective, not only for Britain, but for the whole world. I mean, this is our main way that we're trying to protect health workers who are working on COVID wards anywhere, in Kenya to, South Africa to India. And so the emergence of a new variant is, of course, something we're watching very carefully. And you have to look at where have we seen the most dangerous variants coming from? It's been in countries with large populations with uncontrolled transmission. Think of South Africa, Brazil, India, but also England, Peru. I mean, these are places where you have seen the virus has a chance to mutate, to form many different forms. One of those forms has a selective advantage, and then it spreads and becomes the dominant one. And now Delta, as we've seen everywhere, is becoming the dominant strain and overtaking Alpha. So the question is, what's going to be next after Delta?
I hear your answer. And more importantly, I note that you began by saying this was a massive risk. And that reminds me of what the BBC's health and science correspondent asked in a question just yesterday. His question was, is UK now a breeding ground for new variants? What's your answer to that question?
Well, unfortunately, I think many countries see us that way, which is why we're on the red list and they won't take in, we become in some ways almost a pariah for wanting to travel to other countries, because we are seen as being irresponsible in how we are handling that pandemic in terms of not paying attention to case numbers. So I think potentially yes, but I think the real lucky thing is that confirmed cases are coming down. We now need to see the ONS, which is kind of looking at community infection, also coming down. And then we can say, okay, hopefully vaccines and people's changes in behavior are keeping the numbers low enough that we don't see that. But I think it is, we talked a lot in Britain about where can we travel to? And in the end, actually, there are not very many places which will still take in British people because of that risk of variants.
We're coming to the end of this interview, but against the background of everything that we've discussed, in your opinion, how clear or how confusing and perhaps even contradictory is the official guidance the British government is putting out? I noticed, for instance, that in England, masks are not compulsory, they're only recommended. But in Wales and Scotland, they remain compulsory. And even in England, according to the BBC, on Transport for London services, masks are required, but on Thames Link trains, they're not. And when one sees this from the outside, it not only looks messy, it almost looks like an attempt to encourage people to end up doing the wrong thing.
Yeah, the messaging has been a real problem. Wear masks, don't wear masks, go work in your office, don't work in your office, go abroad on holiday, don't go abroad on holiday, stay home, go to certain places, not others. I mean, it is completely confusing. And I think what we've seen out of it is that people are now trying to listen to trusted medical sources to say, what should I be doing? And listening to those, hopefully. So in a way, I think it has encouraged confusion, but people are now 18 months in. I think it's different than where we were at the start of this. They've seen a lot, they have heard a lot, and now they are making choices and informed choices based on what they've heard. And even it's little things like, for example, people are not choosing to sit in restaurants, they're getting takeaway or sitting outside. It's people choosing to wear face coverings in shops and public transport, even if they don't have to. It's actually a big push this summer, people staying locally in Britain to do tourism and not to go overseas because it's so uncertain as well when you go overseas of what the rules might be. So in some way, out of that chaos, you've seen people actually saying, okay, we're 18 months in, what have we learned and how can we actually start to make those choices, including employers who, unlike last summer, haven't forced people back to the office. They did that last summer and they saw what happened. So now they're actually being more careful because they don't want to have transmission in their settings, in their workplaces.
We're coming to the end of this interview. It's perfectly clear from everything you said that the British government took a terrible risk, but they've pulled it off because the British people, to everyone's surprise but delight, have behaved very responsibly and cautiously, and therefore they've ameliorated the risk. But no one could have foreseen that before the restrictions were lifted on the 19th of this month. So go back 2 weeks, 3 weeks in time. If the British government had asked for your opinion, should we lift all restrictions? Would you have said, no, it's a terrible risk, don't do it?
Oh, and I would still say no. I still think there is a huge risk in having nightclubs open with no restrictions and having lots of young people getting infected and many of them getting seriously ill and having long COVID. I still think it was a mistake that they said no compulsory face coverings. It's confusing, as you just highlighted. So I think, like in Scotland, they should have said, just keep going, keep as it is. So I think even now they might need to backtrack in a few weeks. So I think it's maybe too early and premature to declare success. I think anytime you declare success in this pandemic, it comes back to bite you later on. And you know that actually it was just one more chapter and there's another chapter ahead of what's to come as we head into winter.
There was a very interesting half sentence in that answer. Even now, it's possible that the British government may have to backtrack in a few weeks. I believe that's precisely what happened in the Netherlands, which is almost just next door. They had to reimpose curbs on bars, restaurants, and nightclubs. And you think it's well within the realm of possibility that the British may have to do something similar in a couple of weeks' time.
Of course. I mean, we've seen this repeatedly. I mean, think of last summer, they declared the end of the pandemic in summer 2020. And then we go into winter, there was restrictions. They said it'll be over by Christmas. We're going to have a normal Christmas. And when Christmas came, we had a second, more deadly wave in January. They said it'll definitely be over once we have vaccines. We have vaccines rolling out, but we realize, as you highlighted, that it's not, Delta variant means the coverage we need to have is so much higher to stop transmission. And we see a bit more people who can get infected even after being doubly vaccinated, which is, again, something we hadn't necessarily anticipated at the start when people it seemed to stop transmission at the start with the original variant, the original wild type. So I think at any point when you say, we're never going to do it, it's irreversible, something arises and you have to be able to go backwards and say, well, actually, was that the right decision or not? And the big challenge going into the fall is going to be schools. How do we get schools back and make sure we don't have a whole epidemic in young people and end up with many cases of long COVID, which is obviously a big concern for parents and children.
Professor Sridhar, thank you very much for this interview, and thank you very much for opening the eyes of the audience in India, both to the terrible risk the British government has taken and also why at this moment it looks as if it's actually pulling it off, but what are the dangers that lie ahead which could end up forcing the government to actually retract and go back to restriction. I'm extremely grateful. Take care. Stay safe.
Thank you very much. Have a good day.